I know there's people coming, so that's all good. Here we go. Oh, they're racing in now. Racing in. You've got some live people, live humans in the Wombat Burrow?
I have a live human.
Good. How wonderful.
And then we've got Scotty on the phone.
Yep. And we have Kerrie. Yep.
Hi, Scotty.
Well, we can still just maybe wait a minute or so.
I'm happy to wait another minute or two.
Yep.
I mean, I have been known to talk to the ants, so.
Well.
I used to drive 700 or 800 kilometres to talk to two people, so that's fine.
Well, I'm a musician, and the odd occasion, a friend of mine and I had a gig. We had an audience. Well, actually, more people did join. I have to say, it was at a festival, but we started with one person, so it filled up after a while. But you know, you just got to sort of smile to yourself and go, "Oh well." You know, you take the swings and the roundabouts, and I'm sure I'm very interested in what you've got to say anyway. So I'm sure there's be a few of us here. So
yeah.
Scotty says he'll be moving there. Scotty, they'll be moving around a lot. Okay, and leaving the video off. Okay, that's all good.
And there's a couple more coming in.
Yep. Oh no, they're powering in now. Yep. Yep.
Look, I have the power to admit.
Good. Yeah. Well, it's nice to have a little bit of power in this life, isn't it? Just a little bit of power.
I'm more than happy to start with who we've got. Or wait a couple of minutes. It's up to you, Simon.
Look, I think why don't you kick it off now? You're ready to go, and so the floor is yours.
Okay, thank you very much, everybody. It's kind of funny doing a Zoom conference somewhere else than in my own backyard. So let's get underway. This is my presentation. Down the bottom is about me and stuff. It's got to get the slides working. First of all, I would like to make a few acknowledgements. So I actually live and work on Waka Waka, Yinabara and Yagara land. And I acknowledge the elders, custodians and healers, past, present and future of all the lands on which I live, work and study. So I am also studying and the campuses are spread across Australia. I also would like to thank the Somerset region community, which I'll talk about a bit later, but they have joined me on this journey of community herbalism. And the other acknowledgement, which is not on here, but I would also like to acknowledge the plants and the healers more broadly in the global community, because it is really their knowledge that I work with, not my own. So a little bit about me and my journey. I guess just looking at the two photos there, I guess I can sum myself up as saying I'm a little bit different. Yes, I do live in a dome house. And yes, my partner does wear a dress. He actually is very comfortable in all sorts of different types of and forms of clothing, but he's happiest when he's in our garden. We live on a 45-acre property, which is as self-sufficient as you can be, given that self-sufficiency itself is not really something that anybody can achieve. But we live off-grid, we grow our own food, we have goats for our own milk, cheese, yogurt and so on. We have an off-grid solar system, we have an off-grid biogas system. My journey really started out as a teacher. And I guess I consider myself still more of a comfortable educator than anything else. I've worked a lot with community. 15 years ago, I was involved in pandemic planning for the Queensland government. So I kind of think there's a bit of interesting synergies happening in my world at the moment. And I am now a herbalist of 5 years standing. And I start most of my workshops by explaining that I'm probably not your typical herbalist either, in that I am the classic brown thumb. Yes, I do kill cactus. And I don't actually have a natural affinity for herbs or plants. It's something that I've had to work hard to achieve. And as I say, the plants themselves and the herbs themselves have done more of the teaching and more of the work than I have. I just sort of try to absorb what it is they're telling me. And so that's pretty much where I'm at, which leads me to, from a health perspective, community herbalism, well, what's the problem? What is it that started me or got me going in the direction I am? And these are some of the statistics, and there's lots of statistics out there. Basically, these ones, like, for example, more people die from disease than from war. The biggest killers are those preventable chronic diseases, those who are disadvantaged and not fairly represented in those statistics. So obviously, if you are on some scale disadvantaged, you are more likely to die from a chronic disease. And it's costly. So our healthcare system is spending an awful lot of money to try to keep us alive, but it's actually not, but the chronic disease expenditure is very small. If we did healthcare differently, and so 500,000 less Australians would have a chronic illness, we'd reduce our healthcare costs in hospitals alone by $2.3 billion, and we'd write 5.3 million less prescriptions. I guess I was kind of blown away by those figures. And this is kind of this, and the World Health Organization themselves say that our system is kind of focusing the wrong way. We're focusing on hospital-based curing diseases. We've got the silos, and we're limiting the capacity of people to make their own choices, to make their own decisions, to have the control over their health. And I see that with my clients when they can't even describe to me what it feels like to be healthy. They've kind of lost touch. This is the first of our breakout rooms for an interactive workshop. And obviously, feel free to, I've got to try and find out how to bring the chat room up. I don't want breakout rooms. No, I want chat room. Sorry, because what I'd like to do is try to get people here saying to me or sharing with each other, what are the principles that you think we should have in our healthcare system?
Kerrie, given there's only a relatively small number, we could probably go out of the share view and into the screen, and we can then actually speak to that or write things in the chat. Would that be one? I think if people are happy to either write into the chat or bring themselves off mute and make a few suggestions of what you think might be important. Hi, Penelope.
Hi, yeah, I was thinking that choice stands out to me as something that would make a really big difference in our healthcare system.
Yeah.
I'm going to jump in and say opportunity and access, so that we've got equity with both of those.
Yeah. We've got in the room here, we've got somebody here who said people and staff having enough of. So we've got choice, we've got access, we've got resourcing. Any others? Okay, well, let me tell you what the World Health Organization thinks. Particularly important people-centered care. And I guess as a herbalist, I would say, and plant-centered care. And co-production. So this is about thinking about the people who are receiving or part of the system. And it's not just the patient, it's the individuals, it's the people who care for them, it's their family, it's their community, it's the doctors, it's the nurses, it's the system administrators, it's all of those people. And it's not just the clinical, when I go in to see my doctor, this is what I get, but it's what's happening outside of that clinical experience as well. And it's also the co-production of healthcare. So people, families, communities, we all use those services. We should all be involved somewhere along the line in designing and developing those. So those were two of the principles that have been recognised by the World Health Organization. There's a few more here, just again from primary healthcare. What you need in your community. It's an integrated system. You shouldn't have to think about where you need to go to get care. You should be able to know that. It should be fairly obvious to you. You should be able to get that care from people you trust and from systems you trust. Reliability and resilience. So again, if you wanted to put something into the chat room for this question. So we've got prevention, choice, resources, access. So what might you include? And I guess this is a bit different from the principles in my mind. So the principles are kind of like the values that we might have. In the healthcare system itself, what would we have in it? What might we include in that system?
Well, I'm going to jump in and say diversity, so that we've got access to things like natural as well as alternative. I mean, I don't call natural medicine alternative because that's the traditional. So in my world, so we'll say allopathic and traditional sort of, healing, as well as obviously, placing a little bit more emphasis back on bush medicines and relevant to area and that sort of thing.
Yeah. Any other ideas? So primarily traditional, not just GPs, yeah? Simon?
I was just going to say, I think much easier access to the more than human world. That's since a connection to landscape, to plants, obviously, to the multi-species communities around us.
Yeah.
I suspect would be a really important part of a much healthier community and individuals.
Okay, so the reason why I asked this question is because this was kind of the dilemma that faced me when I first started practicing as a herbalist. So recognising that, I'm not a natural plant person, give me an animal or a book any day and I'm happy. Give me a plant and I'm kind of, oh no, I'm not sure what to do with you. Oh dear. I was also, so I decided to study herbal medicine. Yeah, it's kind of like, why, if you don't know plants, why would you choose herbal medicine? I've always been fascinated by herbs. I've always had a vision in my mind of having a herb garden. I love the medieval stories and fiction where there's a herbalist, the herbalist monk, that type of story. I've always loved that. Living on a self-sufficient off-grid property, my partner and I both rely on medications to keep us alive. My partner has an interesting health story. And we have a philosophy on our property that basically if you come onto the property, you have a purpose. Sometimes it's a bit of a stretch to have, you know, what's the purpose behind another book in my library? Well, you know, it's relaxation for me. So it's like, so I married that fascination with herbs and wanting to know more about the medical properties of herbs and how to use herbs with a potential need to use herbs if for some reason I couldn't access the medications my partner needs. With anything I want to grow, it would be good for it to have a purpose. So that kind of all mixed together in my mind. And as part of the study that I did, I never actually planned to be a practicing herbalist. It was always just an academic, personal interest. But obviously studying natural medicine, I had to do a subject on, had to do a business plan for setting up a clinic. And that got me thinking a little bit. And that got me thinking about what I would include and how I would practice as a herbalist. So this is my clinic, believe it or not. So I'd like to introduce you to the Somerset Community Herb Clinics, which is a bit of a venture between myself and Herbalists Without Borders. So at the time I was thinking about starting up a herbal medicine clinic, I had a dear friend in the US who sent me some information about Herbalists Without Borders and about a particular herbal medicine practice over there that just touched all my buttons in a lovely, nice way that went, here's how you can do all the education stuff you like, the community development stuff you like, the people work that you like. So I recognised in doing my studies that there were health risk factors for the majority of my potential clients, but I believe in the power of community. In this map, the little green dot down in the bottom southeast corner of Queensland is where I live and work, the Somerset region. And on all sorts of social indicators, we're not doing very well in our region. So a lot of the things that contribute to people's poor health, so their economic status, their capacity to work, their health insurance, their education levels, their age. Basically, my region was behind the 8 ball when it came to it. We had all of those factors. In some parts of my community, 80% of people live below the poverty line in some of the smaller communities in the region. When I was looking at, well, what fee would I charge as a herbalist? There's no set fee, but there's a recommendation from professional bodies that roughly works out to about $150 per 90-minute consultation. I live on a pension. My partner lives on a pension. We're in a fortunate position. But if I was to rely on that pension to pay my rent, to buy my food, to pay for fuel, to do all the things that people need to do, I couldn't afford me if I was to charge the going rate. And that's the picture for the majority of people in my region. So it's kind of like, for me, kind of going, well, if I'm going to start up this business and charge $150 an hour, I'm not going to be very successful as a business person. That's okay. But I really believe that natural medicine is a form of medicine that has a lot to contribute to health. So I really wanted to make it available to people in my community. And this is my clinic in all of its various forms. So I use spaces, and this is where the community part of it comes in. So I use spaces and buildings that are owned by my local council. I pay a nominal rent of approximately $5 a month to rent those spaces. Prior to COVID, prior to the pandemic, I was operating out of 5 different locations in the region. So once a month, I would drive from my home to another spot in the region and set up a clinic. So I would take my herbs in their bottles and jars and things. I would set up information stalls or tea stalls. So the idea was to just drop in. If you see the clinic sign outside the building, come on in and say hi. And talk about herbs, talk about your health and things like, and how herbs might be able to work in with what you're doing. And I charge there's all sorts of ways of charging. I charge a flat rate. If you can show me that you live in the Somerset region, you pay the flat rate. People said to me, oh, what about sliding scale fees and things? And I said, well, that would mean I'd have to know what somebody's income is. And to be perfectly honest, I don't care. I don't care what somebody's income is. That's not important to me. What's important to me is that they want to do something to work to be healthy, and that I might be able to help them. They might have knowledge that they can share with me. And the Gypsy Caravan is kind of the travelling clinic. So I can load her up. She's fully self-contained. She has her own solar system, her own batteries, her own power, her own water. So I can drive her anywhere in the region and set up a clinic space that meets legal requirements. And that's kind of the idea behind the clinics and what we're trying to do. And we were starting to achieve it just before the pandemic. And then of course the pandemic shut everything down. And because I use council spaces, I had to follow their requirements for who could use their venues and things. But I'm slowly starting up again. But the real driver behind it, and again, the pandemic put a bit of a kibosh on it, but we're starting up again next year. The real driver is that they're not my clinics. The clinics belong to the community. And so I and a small group of people are setting up a cooperative to run the clinics. So it's not a hierarchical structure. Cooperatives by their very nature are structures that are shared decision-making, all together working in that space. And we have the rules all ready to go. We have, all we need to do now is basically have the vote to say, yes, we form the organisation, we recruit. Membership to the co-op will be to anybody in the Somerset region who has a valid Somerset region address. And ultimately, where I go to set up the clinic will be determined by the co-op, not by me. I travel with, or have on my practitioner books, I have remedial massage therapists, I have energy healers, I have chiropractors, I have, I think I mentioned, I have trauma counsellors. So I have a whole range, and we're slowly building up a network of locally based practitioners who can come and set up with the clinic as well. So it's kind of multimodality for the language stuff. The other part, so then part of the challenge of setting up the co-op is working out, because again, the co-op is shared decision making, but it's also shared action. So to be a member of a cooperative, not only do you receive a benefit from the cooperative, but you put something into the cooperative. So the idea is that when people sign up to be a member of the cooperative, they agree to do a certain proportion of work towards managing or keeping the organisation going. And I can pretty much guarantee you that for any particular person with any particular skill set, I can think of a job that I would love to have them do to help the clinics be as good and the best that they can be. So for example, yes, we have a Facebook page. I hate Facebook. I hate social media. I'm not very good at keeping it going, but I know that there are people who are passionate about social media and passionate about communicating. I have a website. I used to design websites, so I'm kind of okay with that, but I'd really like for somebody else to take that on. One of the big things, obviously, for herbal medicine is the herbs themselves and the plants themselves. Now, sustainability is a big issue because it can take kilograms of plant material to make a 500 gram or 500 ml bottle of medicine. So we have to look at sustainable ways of doing that. And one of the things that we've started doing, everybody talks about, oh, let's have a community garden. And that was kind of a feature of the model when I first started looking at it. And as I went around talking to people in the community about setting up the herb clinic and what would they like and could we grow our own herbs, I got the strong message that everybody loved the idea of having a community herb garden. Everybody loved the idea of growing our herbs and using our herbs locally. And everybody was looking to me to look after the garden. And I made the admission at the beginning of the workshop, I'm not a green thumb. I kill cactus. I walk into Bunnings to buy a plant and I say, who's coming home to commit suicide? Because that's a very big risk when it comes to being a plant in my herb garden. So I started to think, well, okay, everybody wants community gardens, but nobody really wants to be responsible for managing a community garden. How can I do this? And I thought about all the gardeners that I know, and I have never yet met a gardener who will walk into Bunnings or into a nursery and buy one plant. They never leave with just one plant. They go in with the plan to just buy one plant, but invariably they will buy 5 or 10. I have never known a gardener who doesn't have room for one more plant in their garden. So I started to think a little bit bigger, and instead of having a whole lot of community gardens in local communities, I'm just going to turn the whole region into one big community herb garden. So I get grants from Herbalists Without Borders, and do you know how many seeds you can buy with $500? It's thousands. So I give them away. People come to a clinic day, they leave with a packet of seeds. I work with clients and come up with a herbal formula. I give them seeds. Ultimately, we will do seed audits and plant audits. Most people are fully familiar with things like, you know, the good old parsley, sage, rosemary, and thyme. They're not just for cooking. They are really effective medicine. So the idea is to get people growing the herbs and having that happen. So how does that work in practice then from a clinic point of view? It works brilliantly. So earlier this year, or late last year, I broke my ankle. That turned into a medical emergency where I ended up with blood clots on my lungs, which meant that I was housebound for 5 months. I had a client ring me in the middle of that period with a desperate need for a painkiller and pain relief. I knew she had a rosemary plant in her backyard. So I said, go and get some rosemary. She was in such pain that she couldn't even step outside her door and go down to her yard and get some rosemary. So we put a post up on our Facebook page asking if there was somebody in her town, in her community, who had some rosemary who could drop it off to her house. Within 15 minutes, we had enough rosemary on her doorstep for her to have pain relief for a month. That's the power of community. That's how it can happen. I get random phone calls from clients and from people in the community. Hey, Kerrie, I'm standing in such and such an op shop and there are bottles and jars here. There's a box of bottles here. Do you want them for the clinic? I'll pay for them for you. I have one client in particular who regularly pays me twice the fee for a consultation, one for herself, one for the next client who comes in the door. Now, we haven't yet kind of formally set up the organisation or anything, but this is already happening. I have great visions. Like one of my big expenses at the moment is posting herbs, and particularly during the real lockdown where I couldn't go anywhere. How do I post herbs to people? That costs money. I've got to build that into the costs of the medicine. I live on a school bus route. The school bus goes right past my front door, goes into town and drives past one of our local libraries. We have a network of local libraries across the region. So the scheme that I've been cooking up with one of the, I've just got to mention it to the librarians, is I will put the herbs on the school bus. The school bus driver will take them and put them in the local library. The library will use their interlibrary transport network to take those herbs to the library closest to the client. That's how community can work. So I guess from a, I'm a PhD student, so you can't get away without some form of theoretical framework. Basically, it's like I have supporters, I have communities, and I have clinics, and I have a whole range of roles that fit into that. But I won't worry too much about that bit. I'm not alone. So for those of you who are thinking, oh yeah, that's just one example, there's a whole lot of alternatives. There are health cooperatives, there are health hubs, there's alternatives to medical insurance. And for that, for example, the Amish have a health care system that is built on community helping each other. There's another example of that in the US that I can think of under the Ithaca Health Alliance. There's herb buses and herb bikes. There are community health clinics, the Aboriginal community controlled health organisations. So there are examples already where community is involved in running their healthcare. And these are not completely standalone from the broader system of healthcare in the relevant countries. So I just want to really just end off and finish off with some photos of various options. So here, for example, you see a whole range of Herbalists Without Borders projects, seed banks and seed libraries. Herbalists Without Borders literally has chapters and organisations and herbalists globally who work on using community knowledge, using traditional herbal knowledge and incorporating that. And so as an international organisation, basically that's supported to as much of a degree as possible. So for example, in the US, if I was working in the US, I could apply for a seed grant and I would get sent seeds. Obviously, we can't send seeds too easily overseas, internationally. Sometimes they get stopped at borders because people don't know what the seeds are. Sometimes they get sprayed at borders because we have biosecurity risks, all of which are valid. So instead, I can apply for a grant of money. And as I say, $500 buys an awful lot of seeds. I mentioned the herb bus. So the herb bus is literally a bus. And this is kind of where I first learned about community herbalism. So the herb bus was established in Atlanta after Hurricane Katrina. And like my little caravan, the herb bus is a fully stocked mobile herb clinic. They have a network of supporters and they have a scheme called Grow a Row. And so again, they just recruit people to grow herb plants, harvest the herbs when they're ready. They then have medicine making workshops. So they bring the community together and they make the medicines as a community that then get used in the herb bus clinic. The rules are a little bit different here in Australia. There's a few things that we have to try and get around, but basically what we do, or what I've been doing, is making medicines and teaching people how to make the medicines for themselves. No, that's not my herb van. The little green Althea, the little green gypsy van is my herb van. This is the herb bus in Atlanta. They also, think outside the box. Shopping trolleys make good little mobile herb carts. Again, obviously the sort of healthcare system in the US is a bit different and they have a lot of communities. and a lot of people who are homeless, people who can't afford healthcare, they don't have the system where, like us, we can walk into an emergency department. So there's a lot of street work happening through the herb bus and the herb cart. They then have expanded over. So in Ireland, they have a herb bike. And so, yes, they literally have somebody on a bicycle with a little clinic, and they travel around and make things. Now, if you look here, there's up in the top left-hand corner, there's little herb care packages. What Herbalists Without Borders and what I do in the Somerset Community Herb Clinics is we make emergency volunteer support packs. So basically, bushfires 2 years ago in Somerset region, and with donations of herbal materials from other herbalists, from herbal manufacturers, put together little herb care packs, basically contain a little calming, relaxing thing, some tea bags, some relaxing tea bags. Not everybody drinks tea, so we put in a coffee substitute, which is a herbal coffee substitute, which has relaxing properties, bath bombs and things for smoke inhalation, foot care pack, so basically a herbal foot soak for, I don't know if any of you have ever been an emergency service volunteer. Those boots get very heavy after a few hours out in the field and your feet start to get really sore. Going and sitting with you and soaking your feet is really nice. One of the things that gets used a lot is energy lollies, not always healthy. So I make up herbal healthy, basically herbal gummy bears. And they have relaxing and respiratory support. So this is kind of the project. And again, I have people who will come along to a workshop and help package all of those materials, put them into little canvas bags that we then take out to the fireys and we give to them, and with the instructions that when you use the product, bring your bag back to us and we'll refill it for you. So we're now looking at expanding that out to Southeast Queensland with the dream, and it's a big dream, I'm happy to admit I dream big, but the dream of every emergency services volunteer would get their own little herbal self-care pack. We expanded that out now to couch surfing teenagers from our local high schools. And again, a lot of these products are donated, or members of the community put money in and buy products that we can then put in there, and they come along and help package it all up and send it off. That's the power of community. I mentioned the Ithaca Health Alliance. So the Ithaca Health Alliance was started in Ithaca in New York by a herbalist who's probably my all-time hero. But it's not just herbal medicine. They have GPs, they have chiropractors, they have physiotherapists, they have occupational therapists. They've set up a community health fund, and it's a grant program. So anybody who needs it can, in the Ithaca community, can apply to get it so that their emergency healthcare is covered. We have a cooperative hospital here in Queensland, in Clifton, set up many years ago, and it has a cooperative model to it. So, and this is a normal hospital with aged care facilities and things as well. That's me. And I know I probably haven't taken up anywhere near the 50 minutes, or maybe I'm close, but I guess I'm kind of going, let's just open this up if anybody has questions or comments or discussion or anything. Happy to chat.
That was really lovely, Kerrie. So anyone has any questions, just there's such a small group, just unmute yourself and let's have a conversation. It's a wonderful opportunity. We've got a good 20 minutes or so left yet.
I noticed that Kyle asked about mushrooms. I'm allergic to mushrooms. So there is a company here in Byron Bay who supplies all my medicinal mushrooms free of charge for use in the clinic. And they've given me lots of education about mushrooms and explained the difference to me between the mushrooms you eat that are particular varieties and the mushrooms that are used medicinally. They're a company that sustainably harvest their mushrooms. They work direct with the growers and the mushroom growers. So yes, we do use mushrooms. No, we don't use the psychedelic version because they're illegal. But also I don't know enough about them, and I won't work with something if I don't know it. It's not. Similarly, so for example, there are a number of Indigenous plants or Australian plants that the Indigenous communities have used historically. I'm aware of them. I know a little bit about them. One in particular, which everybody's probably reasonably familiar with, is Gumby Gumby. I get asked often about Gumby Gumby, but I'm not Indigenous. I don't know how it's traditionally used, and I don't have permission or approval to use that as a healing plant from the Indigenous community. I try wherever possible to refer people onto an Indigenous healer or an Indigenous elder if they're specifically set on using an Indigenous plant. People ask me about cannabis, and yeah, I'm not allowed to prescribe it at all. It's a plant, but it's on the poison schedule in a spot where I can't use it, even though it has many good healing properties. But this sort of raises issues for people, and it's a really great opportunity as a herbalist working directly with my community, because herbal medicine is beautifully personal. Obviously, doctors get this too, but people come and, oh, Kerrie, you're a herbalist. Oh, well, what herb can I take for insert condition here? And my stock answer is, well, there's about 15 to 20 different herbs that I could suggest to you, but I really want to know who you are so that I'm sure that you are getting the herb that works best for you. For example, old wives' tale, but with a lot of science behind it, ginger for nausea. People know that if you feel nauseous, if you feel seasick, if you've been pregnant and you get morning sickness, have some ginger. I feel sick if I eat ginger. So it's the last thing I would give myself. So even though it's healthy, it's not appropriate for me. And herbs are like that, and people are like that. We match the herb and the person. And the joy of being able to teach people to identify and work with and find the herbs that work for them in the mix that it works for them. One of my all-time favourite clients is Parkinson's disease on life-saving medication, which it's not my job to take him off any medication. That's between him and his GP and his specialists, but we know in his case, if he doesn't take his medication, he will die. It has a very unfortunate itchy side effect. So we developed a formula, he and I together, for a cream that he could use, that worked, that he loved with it, and I taught him how to make the cream himself. So he's a client where he was able to grow the plants, he was able to, and we came up with affordable alternatives to the ingredients. So he was a client who faced every month, was pretty much facing foreclosure on his mortgage because of all sorts of circumstances. He's the sort of person who the herb clinic was made for, because by him learning how to make his own cream, not only was he learning about his health condition and learning about his own health, he was back in control of a particular portion of his life that had felt out of control, along with everything else that was feeling out of control. And men, I'm not necessarily, thank you for the compliment. Yes, I feel sometimes awesome, but honestly, there's so many people who are doing this. It's something that I just love doing it. Obviously, I love it so much, I'm doing a PhD on it. So I think it's just one of those things. And yes, people are more than happy to contact me. I'll make sure that the organisers, actually I'll put my email address in. People are welcome.
Kerrie, can I ask you if there's any other questions burning out there in virtual land? So this conference is built around the wellbeing economy. So I'm just interested in your reflections about how this sort of really community-based health approach, when you're not obviously dismissing the medical science system, but we know that health also really can't be sort of carved off into some sort of scientized, approach. We've got to build it around our community. So can you talk about the value of this and helping us build this well-being economy?
I think part of it is that it's just so big, isn't it? Part of it is that acceptance and recognition that we're all in this together. It's like, and that I can only work on a small scale of my own local community. I've been amazed at how many examples there are of those different community things around the world. Interestingly, so I guess this is kind of like, in terms of, I'd love to study this to prove that this community approach works. Instinctively, I know it works to make things better for people, but I actually can't research it because community herbalism, community-supported herbalism has never been academically defined. So that's what I'm doing in my thesis, is to develop a definition that can then be used to go on. But I think it is partly that starting small, starting local, starting to give people and have people have their power back. And that's kind of happening a little bit in the hospital system from my perspective, I guess. But we've still a long way to go in the system. That's also that kind of, I work in the system. So it's like, I know that people are, might say, well, why don't you just run the medicine making and use the medicines in your clinic the way they do over in America? And so, well, no, actually we have a system about how medicines should be made. And I think it's important to sort of fit in with that. But then every so often I make noises at my professional body, say, hang on, can we do this? Can we do that? Yeah, it's that whole swag of combinations of approaches to it, but recognizing that, that co-design, those principles that working together and continually pushing that message of saying, we're talking about health, we're talking about a holistic view, and there is a place for that specific cure, this symptom, in that bigger view. I guess from a herbalist, I'm going, I've got the bigger view. Yeah.
Yeah, no, that's great. There are certainly layers, aren't there? There's the very personal, very local, and then there's a sort of scale up, and then there's the world health sort of stuff, which, the big pandemics that fly around the world that we know so intimately at the moment.
We do. I think the pandemics have really highlighted for more people than probably anything else. What it's highlighted for more people is that we do need to have these sorts of conversations about, at a broader level, about what is healthy, what is not healthy, what is not working for us. And look, we know the figures, people know the figures of those who suffer more from a novel virus are those who are unhealthy to start with. So how can we make them healthier? How can we work with them for them to be healthier? It's actually a great opportunity. Yeah,
absolutely. Okay, other comments or thoughts or ideas? I realise it's the end of a very long day and probably everyone's energy is pretty low.
Thank you to people who've stuck back at what, 7:30 at night almost down south. Thank you very much. And
6:30 in Melbourne, where I am,
Okay.
Wurundjeri country. My dinner's getting close to be ready. Well, listen, if there isn't anyone else wants to, any other questions, maybe we can call it a night, I think, and offer our collective thanks to Kerrie for a really interesting and unexpected, for me, lovely walk through what's happening in a community, because that's again what NENA is about. It's about building those economic networks at the local and regional communities.
can I just put in a plug? So I'm speaking on behalf, the Health Hub of
Yep.
NENA asked me to speak. So please jump onto the NENA website, look at the Health Hub, sign up to be part of the Health Hubs so that we can have the conversations around how we can design our health system.
Fantastic comment. NENA, and I'm on one of the directors for NENA, the hubs are core to what we do. So they are our sort of brains trusts, where everything gets created or networked through those hubs. So please follow that wonderful advice of Kerrie. Okay, well, thanks everyone. Lovely to see all your faces, and have a wonderful night. Rest well, and have a cup of herbal tea, perhaps. Yeah.
Chamomile with a bit of peppermint.
Sounds marvelous. Okay, and we'll see you around the traps tomorrow.
Bye-bye.
Okay, take care. Thanks. Bye.